Hi, my name is David Emerson. I'm a long-term survivor of a blood cancer called multiple myeloma. I was diagnosed in 1994 and have been in complete remission since 1999. I've spent the past 20 years researching multiple myeloma both for my own care and to help others. You're probably here because you or a loved one has just received a diagnosis of pre-myeloma, any pre-myeloma condition. Welcome. My goal for this webinar is to get you up to speed with understanding your diagnosis and the options you have for managing your diagnosis going forward. A diagnosis of pre-myeloma is scary. Understanding your situation and therapies will help you be more in control of your health and your situation. In the next 15 minutes, we will briefly go over my personal pre-myeloma and multiple myeloma journey and identify and define the 3 different pre-myeloma diagnoses, learn about the evidence-based therapies that can help you prevent multiple myeloma from developing, explain the pre-myeloma cancer coaching program that I've created. It has been my experience, and likely yours as well, that conventional oncology offers little in terms of therapies for pre-myeloma conditions. If you get nothing else from this webinar, please know that in my 20+ years of experience as a myeloma survivor and cancer coach, this is simply not true. You can take control of your health in meaningful ways by undergoing evidence-based, non-toxic therapies to manage your diagnosis, to manage your health. So let's get started. You should see a button that says Pre-Multiple Myeloma Introductory Guide on the right side of your screen, my left, your right. Please click that button now so that you can follow along with me. In late '93, I was living with a pain in my neck, literally. When I finally went to see a doctor, he recommended surgery. I don't know if you can see it, but the x-ray showed a mass in my neck, didn't know what it was, recommended surgery. There's a faint scar here and a radiation tattoo for when I was radiated. We'll talk more about that. When I woke up from surgery, I was told that I had multiple myeloma. Though the diagnosis was actually a single plasmacytoma, there was never any discussion of non-toxic therapies to prevent myeloma from developing. I did nothing but watch and wait, and I did develop full-blown multiple myeloma about a year later. I underwent the standard conventional therapies of surgery, again, radiation to this specific area, induction chemotherapy, and a peripheral blood stem cell transplant in December of 1995. After almost 4 years of conventional therapies, remissions, relapses, I was told that nothing more could be done for me. I was told that in the fall of 1997. I researched and underwent alternative therapies and eventually achieved complete remission. Today, I spend my time researching evidence-based cancer therapies through my 501c3 nonprofit, People Beating Cancer. I want to give you the tools to possibly prevent your myeloma that I didn't have when I was in your situation 20+ in 1995. There are 3 diagnoses that are considered to be pre-multiple myeloma. 1, a single bone plasmacytoma, or SBP. 2, let me pronounce this, monoclonal gammopathy of undetermined significance. Everyone calls that MGUS, the initials MGUS. 3, smoldering multiple myeloma, or SMM. Those 3 diagnoses, pre-myeloma. If you've been diagnosed with SBP, this means that you have been diagnosed with a single plasmacytoma and no myeloma elsewhere in your body. Both MGUS and SMM have complicated definitions based on blood chemistry, but the bottom line is that they are not multiple myeloma. They're considered pre-malignant, asymptomatic, pre-malignant blood disorders. The first thing that you learn as a pre-myeloma patient is that in all three cases, you did not have cancer. Usually, you're told just that you can only watch and wait. The second thing that you must learn, and you may or may not have been told this by our oncologist already, is that depending on your age and oncogenic features, meaning your genetic makeup, your risk of progressing to full-blown multiple myeloma ranges from 0.26%, less than 1%, to 12% annually and continues for the rest of your life. In other words, the range of progressing to multiple myeloma is fairly wide. And it's higher for smoldering myeloma patients. In all three of these cases, you're in the rare position of having a pre-cancer rather than full-blown cancer. In my own experience, this means that you are uniquely positioned to have a positive impact on your health and possibly prevent the development of cancer. Studies have found that there are specific non-toxic therapies that can alleviate symptoms such as abnormal proteins in your blood, bone pain, anemia, and kidney damage. Let me be clear on this. The two pre-myeloma diagnoses of SMM and MGUS are considered to be asymptomatic. Your oncologist probably told you that they are asymptomatic, no symptoms. Yet, many patients, MGUS and SMM patients, talk about bone pain. They feel bone pain, nerve pain, blood clots. Their bones, they're higher risk of bone damage. There are supplements that can address those and possibly alleviate your bone pain, etc. The Pre-Myeloma Cancer Coaching Program is designed to help patients prevent a diagnosis of full-blown multiple myeloma through nutrition, supplementation, bone health protocols, detoxification, exercise, cannabis, and mind-body therapies. The program is comprised of 7 guides that cite dozens of evidence-based, non-toxic therapies, most of which I use to this day, with the exception of cannabis, since Ohio, my state, just recently legalized medical marijuana. It's comparatively new. The nutrition guide, as an example, establishes 3 nutrition-based therapies for pre-myeloma patients. First, research cites antioxidant nutrition in general as reducing the risk of pre-malignant cancer, becoming full-blown. Antioxidant foods, nutrition, reduces your risk of a pre-malignant condition becoming a full malignant cancer condition. Your mom was smart to tell you to eat your vegetables. Second, specific foods have been shown to be anti-angiogenic. These foods can actually starve pre-myeloma, preventing it from becoming full-blown multiple myeloma. This is documented in studies. And lastly, by following the nutrition guide, you'll reduce your caloric intake and lose weight. Losing weight is another therapy to reduce your risk of progressing to frank multiple myeloma. The supplementation guide lists 7 supplements linked to research that reduce the risk of multiple myeloma. I take many of these, continue to this day. Further, the supplementation guide lists the most prevalent symptoms of MGUS and SMM, including kidney damage, nerve pain, blood clots, and the HPV virus that can, and then list the specific supplements that can alleviate these symptoms. Again, asymptomatic, but you can have help in these areas. I've taken all 7 supplements for years. For that matter, I also followed the nutrition guide therapies. While my goal has never been to lose weight, I've lost about 20 pounds over the past 20 years by following anti-myeloma nutrition. While pre-myeloma patients might not specifically experience bone pain, it is clear that their blood disorder may be increasing their cortical blood cortical bone porosity and reducing their bone strength. MGUS and SMM patients are at higher risk of bone damage. The Bone Health Guide offers 11 evidence-based, non-toxic bone health therapies. During the first 2 years after my own myeloma diagnosis, I experienced a great deal of bone damage. I follow 10 of the therapies outlined in the Bone Health Guide. To this day, again, bone health is important for us. According to studies, over 90% of cancer is caused by environmental factors. The Detoxification and Exercise Guide explains how detoxification through hypothermia, nutrition, and supplementation reduces your body's toxic load, therefore reducing your risk of progressing to multiple myeloma. I'm confident that my own regular detoxification through frequent moderate exercise, nutrition, and supplementation is one of the main reasons why I have been in complete remission from my own myeloma since 1999. The Cannabis Guide discusses how cannabis, also known as medical marijuana, reduces pain, strengthens bones, and may even be cytotoxic to myeloma. The research is thin because it's controversial in the United States, but the Cannabis Guide lays the groundwork for learning about and understanding how cannabis supports the pre-myeloma patient. As I mentioned at the beginning of this webinar, a diagnosis of pre-myeloma is scary. The Mind-Body Guide provides specific evidence-based mind-body therapies that will help you figure out how to manage your mental health long-term. The online support guide, this is critical. Research shows that patients who communicate with each other learn from fellow patients and can make better decisions about their health. This online support guide lists 7 of the currently established online Facebook communities, closed communities for both MGUS and smoldering multiple myeloma. These online communities are free and private. You have to be accepted, but they're private. No one can read and post other than accepted patients. The Pre-Myeloma Cancer Coaching Program is priced at 2 levels. As a 501c3 nonprofit, the goal of People Beating Cancer is to demystify cancer through information and education. While we get some of our support annually from corporations and grant-making foundations, we ask for modest donations from individuals in exchange for the cancer coaching guides. The basic level includes all 7 cancer coaching guides and is priced at $19.99. The premium level includes all 7 guides plus a 1-hour consultation with me, either by phone or Skype, your choice. The premium level is priced at $119.99. Basic, $19.99. Premium, $119.99. What we discuss during the consultation is completely up to you. Examples of what's discussed could be something conceptual, anti-angiogenesis, a concept that runs through supplementation and exercise. You might want clarification on the therapies and why that's important. An example, an MGUS patient named Adrian sent me her labs, and we talked about her M-spike levels over the previous 5 tests. Caregiver Cheryl asking about her dad's SMM diagnosis, chemotherapy, high risk, low risk, the definitions of each. The discussion, the content is up to you. As you can see, we cover the gamut, the range of questions during consultations. I look forward to working with you. Thank you for your time. Thank you for your time and attention.